Hello everyone. Imagine a disease that can silently damage your eyes, kidneys, heart, brain, nerves, and blood vessels for years before you even realize it's there. A disease that affects hundreds of millions of people worldwide and is increasing at an alarming rate. That disease is diabetes mellitus. But here's the shocking part. Many people think diabetes simply means high sugar. In reality, diabetes is much more complex than that. Today, I'm going to explain everything you need to know about diabetes, from its causes and types to the latest treatments, prevention strategies, and some fascinating new discoveries that are changing the way we understand this disease. By the end of this video, you will know more about diabetes that most people ever do. What is diabetes? Diabetes is a chronic metabolic disorder characterized by elevated blood glucose levels. To understand diabetes, we first need to understand insulin. Insulin is a hormone produced by the beta cells of the pancreas. Think of insulin as a key. Glucose is the fuel of the body, but it cannot enter most cells without insulin. Insulin unlocks the cells and allows glucose to enter where it can be used for energy. When insulin is absent or insufficient or ineffective, glucose remains in the bloodstream, blood sugar rises, cells become energy starved. Over time, high blood sugar damages your eyes, your kidneys, your nerves, your heart, your blood vessels, your brain. This is diabetes. Now, how common is diabetes? Diabetes is one of the fastest growing health problems in the world. India is often called the diabetes capital of the world. Millions of people are living with diabetes, and many don't even know they have it. Even more alarming, for every diagnosed diabetic patient, there are many other with prediabetes silently progressing towards it. Types of diabetes. There's type 1 diabetes. Type 1 is an autoimmune disease. The body's immune system mistakenly attacks the insulin producing beta cells of the pancreas. It results in virtually no insulin production. Commonly occurs in children, in teenagers, young adults, and it has got symptoms like excessive thirst, frequent urination, weight loss, fatigue, sometimes blurred vision. Talking about this treatment, insulin is a mandatory for survival. Without insulin, patients develop diabetic ketoacidosis or DKA, a life-threatening emergency. Now comes type 2 diabetes. This is the most common type. More than 90% of the diabetic patients belong to this category only. Two major problems occur: insulin resistance and progressive decline in insulin production. Initially, the pancreas produces insulin, but the body's cells stop responding effectively. The pancreas works harder. Eventually, it becomes exhausted. Blood sugar rises. Speaking about the risk factors, obesity, sedentary lifestyle, family history of type 2 diabetes, hypertension, poor diet, and aging. Number third is the gestational diabetes. It occurs during pregnancy. Pregnancy hormones can cause insulin resistance. Why is this important? Because it increases risk for large baby, difficulty in the delivery, future diabetes in the mother, future diabetes in the child also. Most causes result after delivery. Now let's talk about type 3C diabetes. Many people have never heard of this. It occurs due to disease affecting the pancreas, such as chronic pancreatitis, pancreatic surgery, pancreatic cancer. The pancreas becomes damaged and cannot produce enough insulin. Type 4 diabetes. Recently, researchers have proposed a form called type 4 diabetes. This refers to age-related diabetes occurring in some older adults who are not obese. Aging itself appears to alter insulin regulation and beta cell function. Research is ongoing and this category is still being explored scientifically. Now, type 5 diabetes, a recently recognized form associated with malnutrition related diabetes. It's often seen in individuals who experienced severe undernutrition early in life. Unlike type 2 diabetes, patients may not be obese. Insulin deficiency plays a large role here. Recognition of this subtype highlights the importance of nutrition during childhood and adolescence. Another important but less common form of diabetes is MODY, or maturity onset diabetes of the young. It's a genetic form of diabetes caused by mutation in a single gene affecting insulin secretion. MODY typically appears in adolescents or young adults and often runs strongly in families across several generations. Unlike type 1 diabetes, it is not autoimmune, and unlike type 2 diabetes, it is not primarily caused by insulin resistance. Recognizing MODY is important because treatment and prognosis can differ significantly from other types of diabetes. Now, what is prediabetes? Prediabetes is a warning stage. Blood sugar is elevated but not high enough for diabetes. Without intervention, many people progress to type 2 diabetes. The good news is prediabetes can often be reversed. Now let's talk about the risk factors. Major risk factors include non-modifiable risk factors like age of the patient, family history of the patient, ethnicity of the patient, genetic factors. Now let's look into the modifiable risk factors like obesity, physical inactivity, smoking, unhealthy diet, poor sleep, chronic stress, hypertension, high cholesterol. These are the things which you can modify. Abdominal obesity is especially dangerous. Waist circumference often predicts risk better than weight alone. Now let's talk about the symptoms of diabetes. Classic symptoms include excessive thirst, frequent urination, excessive hunger, weight loss, fatigue, blurred vision, and some other symptoms like recurrent infections, slow wound healing, numbness, tingling in feet, and erectile dysfunction in males. Many type 2 diabetic patients remain symptom free for years together. How is diabetes diagnosed? Diagnostic criteria include fasting blood sugar that should be more than 126 mg per dl or higher, HbA1c 6.5 or higher. Oral glucose tolerance test is used in selected situations such as pregnancy. Now, speaking about the complications of diabetes, there are eye diseases. Diabetic retinopathy remains a leading cause of blindness. Kidney diseases. Diabetes is one of the leading causes of kidney failure. Nerve damage. It can cause burning feet. It can cause tingling. It can cause numbness. Speaking about the heart diseases, diabetes significantly increase risk of heart attack and stroke. Another thing is diabetic foot. Small injuries can progress to ulcers and amputations. Daily food care is essential. Prevention of diabetes. Research consistently shows that prevention works by maintaining healthy weight. Even a 5 to 10% weight reduction can dramatically reduce the risk of diabetes. Exercise at least 150 minutes per week, moderate activity plus some strengthening trainings twice weekly. Healthy diet, you should also focus on vegetables, fruits, whole grains, legumes, nuts, and lean proteins. Reduce and avoid sugary drinks, processed foods, excessive refined carbohydrates. Talking about sleep, aim for 7 to 9 hours of sleep. Stop smoking because smoking accelerates complications. Now, talking about the modern treatment of diabetes, treatment today is much more advanced than it was a decade ago. Lifestyle modifications still remain the foundation. No medication can fully replace a healthy lifestyle. Now let's look into the medication part. Number one is metformin, often the first medication prescribed. Talking about its benefits, it's effective, it's affordable, it's well studied. Number two is SGLT2 inhibitors. Examples include medications such as empagliflozin, dapagliflozin. Their benefits are they lower blood sugar, protect kidneys, protect your heart. These drugs have transformed diabetes management. Number third is GLP-1 receptor agonists. The examples include semaglutide, liraglutide. The benefits are they have excellent glucose control. They also have significant weight loss properties. They have cardiovascular protection. These medications are changing obesity and diabetes treatment worldwide. Number four is insulin therapy, essential for type 1 diabetes, many advanced type 2 cases. Modern insulin regimes are far more precise than before. Now let's discuss about some new technologies in the field of diabetes. Number one is continuous glucose monitoring or CGM. Patients can now monitor glucose continuously. No repeated finger pricks. It provides real-time trends in your blood glucose. Number second is artificial pancreas system. These combine continuous glucose monitor, your insulin pump, smart algorithm. This automatically adjusting insulin delivery system. This is one of the most exciting advances in diabetes care. Now let's look into the recent discoveries and future directions. Scientists are exploring stem cell therapies, potentially restoring insulin producing cells. Beta cell regeneration research aims to regenerate pancreatic beta cells. Precision medicine, future treatment may be individualized according to genetics and metabolism. Earlier detection, AI, and advanced biomarkers. These may identify diabetes years before symptoms appear. Let's bust some common myths about this diabetes. Myth number one is eating sugar alone causes diabetes. But the reality is diabetes is multifactorial. Number two myth is only obese people get diabetes. But the reality is many non-obese individuals develop diabetes. Number third myth is once medicine starts, lifestyle doesn't matter. But the reality is lifestyle remains critical for every stage. Final message about diabetes. Diabetes is not just a sugar problem. It's a disease of metabolism, hormones, blood vessels, inflammation, and lifestyle. The good news is that many cases can be prevented. Many complications can be avoided, and modern treatments are more effective than ever before. If you know someone with diabetes or if diabetes runs in your family, share this video with them because awareness is the first step towards prevention. Thank you for watching and see you in the next one.